Hi, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. We have an excellent show for you today, just an excellent show. But first, what I'd like to talk about is sharing and caring. You understand, sharing our med moments, those moments that you have that chest pain or that knee pain that just won't go away, or that shortness of breath when you're walking up the stairs. Those are med moments. You can go to www.medmoments.com. Send me an email. I've enjoyed all the emails that you've sent me so far. And believe me, I would like to know what you think about the show, because this show is for you. So if I know more about what you are thinking out there, then we can put that forth so that we can educate you, bring that health, education, and wellness to you. Remember, that's www.medmoments.com. Today, our topic is HIV and AIDS, and we have an excellent guest that has come to us today to talk about this disease. His name is Dr. Jack Bogosian, and he's an infectious disease specialist. Dr. Bogosian, welcome to our show.
Thank you, Omar. It's nice to be on your show.
Thank you for coming. You know, HIV is a disease that's been around for a while, and I know it's had some popularity because there are some pretty famous people out there that have contracted the disease. But I think we need to kind of pull back and just talk about just the basics of what it's all about. And if we can just translate that to the audience out there, then I think they'll have a better understanding of what we're talking about as physicians.
Yes.
So let me just step back for a second. What is HIV? Just kind of in simple terms, in terms that I can understand. Tell me what HIV is.
HIV actually is a virus that is being transmitted sexually. It does not recognize any age. Anyone at any age who's sexually active can get it, any race. It crosses all socioeconomic groups, and anyone who uses intravenous drugs may get HIV, and you can also acquire HIV through a vertical transmission, that's from a mother to an infant.
Okay, all right.
Those are the methods that you can get HIV virus.
Okay, let's step back for a second. Now, I understand that it's a virus and that we can contract it we can get it the way that you spoke about. But what does it do to the body? Does it get into the cells, or is it traveling around the blood just willy-nilly, just doing its thing? What does it actually do to us?
Once you're exposed to the HIV virus, the virus gets into your specific type of white blood cells, which is one kind of cells in your blood, and it enters the cells and it starts multiplying. And then it enters in all the organ systems, and it also starts multiplying, and that's how it starts its destruction of your body.
Okay. Now, you say the destruction of your body. Now, it enters the cell, but does it go into the cell and replicate or multiply, or does it multiply in our bloodstream? And is it always multiplying, or how does it, you know what I mean? How does it hurt us?
Yes, initially when you get the virus, when you're exposed to it, there's a period, and then the virus is multiplying inside the cell, okay. and it continues to multiply, and unless you start taking medication to stop it from multiplication.
Okay, all right. Now, I understand that there are good medications out there, and we'll talk about those further on in the show. But as far as the difference, I know there is HIV and then there's AIDS. And I'm just not sure. I want you to tell me, what's the difference between the two?
HIV is the name of the virus that can cause AIDS. By definition, you have AIDS if you've had an opportunistic infection, if you get sick from it.
Right.
If you get sick from the HIV virus, then you can have AIDS, or if it affects a certain number of your white blood cells, a specific types of your white blood cells, and then you can by definition have AIDS.
Okay.
But you don't always have to have AIDS. You can just have HIV and not have AIDS.
Okay, all right. Now, these white blood cells, I know we have a lot of cells in our body, and they're floating around, and they all have specific duties to keep us well. What does a white blood cell do for us?
In the specific white blood cells that are involved in with the HIV virus and take care of us in preventing us from getting infections, and specific types of infections. And if you don't eradicate the virus or keep the virus, the amount of HIV virus in your body low, those infections can occur again, time and again. And so it's very important, if you think you have HIV, to seek help.
Right. Now, is there any age that you're more prevalent to get HIV? Say if I'm, I'm 30 years old, so that's the prime age, or is it prime when you're a senior or a baby? Tell me more about as far as that age related.
You can get HIV at any age, as long as if you're sexually active or if you're using intravenous drugs. However, it does have a higher incidence if you have more sexual activity. If you're younger and you have multiple sexual partners, and you can get HIV at any age, though. It does, you can get it very young and very old.
Okay, so what we're talking about is that if you're going to be sexually active, then protect yourself with condoms and things like that, is what you're talking about.
Absolutely. It's the best thing anyone can do. If you're going to be sexually active, you should protect yourself with a condom in order not to get not only HIV or any other sexually transmitted disease.
Now wait a minute. You're telling me that story that I hear so many times from my patients that they got it from the toilet seat is not true?
Probably it's a hard story to
It's a hard story. Okay. Tell me, as far as, you mentioned something that's very important. You said that a mother can transfer the disease to the baby before it's born. I think you didn't say those specific words, but I think that's what you meant. Tell me a little bit about that. How does that happen?
Right, and so if your mother has HIV and she's pregnant, and during the time of delivery, she can transmit the HIV virus to her baby. Okay. So, however, this does not have to happen. Right. It's completely preventable by controlling the mother's HIV, the amount of HIV the mother has, and giving medications to the mother. Okay.
All right. So what you're saying is that even during pregnancy, the mother can take these medications that will decrease the amount of virus in her blood. That way it will prevent it from going across, the baby from being infected when the baby is born.
Absolutely, Omar. Okay. It's very important, not only even during pregnancy, but especially during pregnancy. It's important to take your medication as directed by your doctor to prevent your baby from becoming HIV positive. Okay. And so actually last few years in this state, there has not been any HIV positive babies born.
Excellent. So the medications are that effective?
They're very effective. HIV has become a chronic disease at this point, and you can live like anybody else. Years ago, when I first started doing this, HIV was a disease that you died from. This does not have to happen at this time anymore.
Excellent. Now I know, since I'm a pulmonologist, I remember back in the day when patients used to come in and they used to get very serious pneumonias from HIV, specific particular pneumonias. Are those type of diseases secondary problems from AIDS? Have they decreased, or are they still very prevalent, or how do we handle that now?
They obviously have decreased a lot than what they used to be when they first started. Obviously, a lot of patients at that time, they came in with pneumonias and all kinds of infections. However, at this time, we still have a certain number of patients that still come in who don't know they're HIV positive, and they present initially with an illness. And through that illness, we find out they're HIV positive, and then get them back into the system of healthcare so they won't have to get any more infections. So it's really important to, number one, to be tested and to follow up with your doctor and make sure if you are HIV positive, you get medications. And just recently, the criteria for starting HIV medications, in the past we had certain criteria we had to use. Now it's recommended that anyone who's HIV positive, regardless of what their white blood cells or immune system is doing, regardless of the amount of HIV they have, should be started in HIV therapy.
Oh, interesting. Now, tell me about symptoms, all right? A patient walks into your office. How would they present? What would be the symptoms that would key you to think, oh, this patient may have HIV?
That's important. That's a very important point you're making, Omar. Number one, many people will have HIV and not know they have HIV. They'll be completely asymptomatic, have no symptoms at all.
Okay.
And so in that respect, they can go on living years not knowing they have HIV. But the HIV virus is still multiplying in their body and getting ready to do some serious damage.
Okay.
And however, when it does start affecting you and giving you symptoms, you can have night sweats, you can wake up at night all wet, and having fevers, you feel like you're having chills, you can have weight loss, you're eating pretty good but you're losing weight, you can get these white spots in your mouth, and you can have cough, shortness of breath, abdominal pain, and a rash, headaches. So it involves all organ systems. It depends on what parts it's affecting it.
Okay. You say it involves all organ systems. I know from pulmonary, as I stated, it involves the lung. But does it involve the heart and the brain or the kidneys? Like, can someone become a dialysis patient and lose their kidneys because of HIV, or have heart failure because of HIV? Is that possible as well?
Yes, it does affect the heart. It gives you what we call an HIV cardiomyopathy, which is just a fancy way of saying it makes your heart weak. The virus attacks the heart muscle, and makes the heart not function the way it's supposed to function. It also does affect the kidneys and give you kidney failure, so you have to be on dialysis. But all that can be prevented if you get help early on time and get started on medication on time.
Right, right. Now, what about as far as counseling? You know, this is a disease, and I understand patients come into our offices and they're scared. They're scared. And we sit down and we do certain tests, and then they come back and to get the results of the tests. How do we handle that as far as delivering the message? Because it's not good news that we're saying, but it's news that in a certain way they could probably deal with if they had certain help. How do we help these patients get through this?
It's important to help the patient understand, number one, it's no longer a death sentence that it used to be when it first started in the early 80s. And it's become a chronic disease. It's like telling somebody you have diabetes or high blood pressure and you can live with it healthy the rest of your life, but you have to be on medication. Right. And there are certain things you have to do and change. And it's also important to let the patients know that they're not isolated. We have support systems, we have groups. You can find out about their family support system, their friends, and what kind of a support system they have and how you can make it work for them. Right. So they don't feel like they're all alone with this terrible disease and there's nothing to do. And it's just not the case.
Right, right. Okay, they're in your office. You think that may be the diagnosis. How do you test for it? What do you do?
It's a simple blood test that we can send out, and it tests for the virus. And it's the simple initial blood test that we do is test to see if you have the virus in your blood by testing the antibody. I'm not going to get into the technical aspects of the test. But we also have the ability of measuring the virus exactly and find out exactly how much of the virus you have in your body.
Oh, all right. Now, if I'm a person, and I know there are people out there that say, well, if I eat healthy, I know that you know what I mean, my immune system, or I've always been healthy all my life, I eat healthy, I take my vitamins, I won't get it. You understand? Is that so? I mean, are there certain people that just resistant to it? They can be exposed and just won't get it.
Well, the first thing is that, obviously we encourage everyone to eat healthy, whether they're HIV positive or HIV negative. Watch your diet, watch what you're eating, and there are, the second part of your question is an important question. There are people who what we call is very slow progressors who get HIV, who may acquire HIV, however, it just doesn't affect their immune system as much as some of the other people that it can be affected with. And you can be exposed to HIV and not acquire it.
Right, right. Now I remember when HIV first came out, just to give you a scenario, and I know you were back training when I was training many years ago. We won't say how many years, but many years ago. And we as doctors, young doctors, were there and we were taking care of patients and blood was all over the place. And basically, we didn't know that it was HIV at that time. And fortunately, the medical personnel did not catch the disease. The thing of it is back then I can remember that certain segments of the population were geared towards having the disease, and it was more prevalent in the gay population. And I know that for a while there, a certain amount, we thought that Haitians may have been more prevalent to the disease. Can you give us an idea of how it plays out today as far as different people are concerned?
Unfortunately, I do remember. I'm older than you, Omar. I do remember those days of early HIV, and it was initially associated with the gay population, the homosexual population. However, at this point, you can be homosexual, heterosexual, bisexual, and HIV. You can acquire HIV by any sexual contact. So it is strongly encouraged that you protect yourself, whatever kind of sex you have with whoever you have sex with.
Right. Now, if there, and what we're talking about is blood transmission too. So if you have a cut on your hand or something like that, and you touch the blood of someone who has HIV, that can be a transmitting vehicle as well?
It's possible, less likely. Less likely. In order to acquire HIV, you probably need a lot more HIV blood to be exposed to. And that is a concept of virulence, which I'm not going to get into. As opposed to hepatitis C, for example, you can get a drop of a blood that goes into your eye, and you can turn positive. In hepatitis B, HIV, you need to be exposed to a lot of blood in order for you to become HIV positive. And that's why when we were training and we were exposed to people's blood, and we didn't acquire the HIV virus.
Right. Now, I know that physical activity is another thing. Like sometimes you worry about if you have too much physical activity, if you may be more susceptible, you're making your body more susceptible, or is it if you're building yourself up, you're less susceptible? What about as far as that's concerned?
Well, we encourage physical activity and pay people to exercise and take good care of themselves, but probably from an immunological point of view, if HIV is going to be affecting you, you can be in great shape. As you know, a lot of famous people and sports people who have HIV in fantastic shape. It probably is not going to change that, although it can help you with with your tolerating your medication and taking care of yourself overall, your health, with your being in shape. Okay,
let's talk about teenagers, because that's a special group. I know that it's a segment of our population that that they're not quite adults yet, but they feel as though they're adults, and some of the things they're doing may not be as responsible as it should be. And do you find that you come in contact with a lot of teenagers, or are teenagers at higher risk? Because just give me an idea of what you think of, or what your experience is.
If you look at the studies, actually, Omar, you're about 40 to 45%, obviously this is not as scientific and accurate studies, but 40 to 45% of kids in high school are sexually active. And so it's very important for us to educate them about protecting themselves. Unfortunately, at that age, most young kids feel that nothing could happen to them, and they're protected from all bad things in this world. And they're however, it's important for us to educate the kids, and and education is really the key here to help them understand HIV transmission, and therefore help them protect themselves about acquiring the virus.
Now that's very important. Tell me something about support groups. I know that there are groups out there for, different types of cancers and stuff like that, but where would someone go to find, a support group that they could relate for people that they could relate to and talk about and get through the tough times that they're going to have with this disease?
Yes, there are actually several organizations in our community have different support groups. Some of them are geared towards teenagers, some of them are women's support groups, or some of them are just men's support groups, and some of them are just HIV support groups. Whatever needs you may need to get some help from. So there's quite a few organizations that can help you with that if you need some support groups to help you deal through some of the tough times that you may have taking care of yourself with HIV.
Right. Now, what about as far as when people trying to get the patient to take their meds and decrease the viral load? Does that decrease the amount of transmission and number of cases that may come about in the future? Is that our goal at this particular point?
Absolutely, Omar. That's probably the most important things. By taking your medication and making your virus undetectable, in other words, it's so small in your blood that even the blood test will not pick it up anymore, then the transmission rate goes down into almost negligent about. So it's very important with this disease. You need to be compliant, which means you need to take your medication at least 95% of the time for you to be to get an effective therapy in your body. Is the correct amount of blood levels of your medications.
Right.
So therefore you have very little HIV virus in your body, and that decreases transmission, which is very important.
Is it possible to get rid of it completely?
Right. There is no cure as of now for HIV. You can't get rid of it completely, but you can suppress it almost completely.
All right. So if you're taking your meds and then you decide, boy, I'm feeling good, and patients out here, I'm feeling good, I'm doing good, just stop your medication. How does it affect you?
Well, the virus starts multiplying again.
All right.
And the amount of the virus in your body goes up, transmission can occur, it affects your cells, it affects your organ systems, you can get sick again. So if you're going to stop your medication, if you feel you need to stop your medication, number one, if you're not tolerating a medication, if it's making you sick, you call your doctor, tell them that. Fortunately, we have 20-some different medications available. So your doctor would be able to change your medication that fits your needs more accurately. And maybe pick a medication that you can tolerate better.
Right.
So it's very important. If you're not tolerating your medication, you get in touch with your doctor and change your medication to continue to keep the virus load down.
Okay. Now, since we started on the medications, what are some of the side effects that the patients may experience with medications?
They can vary from the medication to medication. Some of them will give you nausea, vomiting. Some of them will give you diarrhea, and some of them can give you nightmares. Some of them can give you dreams of different kinds, and so it varies, depends on the medication, and you have to go over with your doctor which medication and its side effects.
Okay. All right then. Well, the thing of it is that it's just so good that we have different medications at this particular point for this disease, because it's just something that I think is just so important for each one of us to understand the risk that we take, if we're going out doing, or if you're having sexual relations with somebody unprotected. All right. So I would like to just ask one more question. Just one more question. As far as the difference between HIV and AIDS, I'm still a little not quite sure as to what's the difference. I know HIV, you have the virus, and the virus is in your blood. But as far as AIDS are concerned, is it because you may have caught a certain disease, like a certain type of pneumonia, or what makes you go to that side of the, that side of the
right
wheel?
There are a couple of definitions of AIDS. One of them is just exactly what you just said, is as far as getting a certain certain infections that would put you in that category of AIDS. And you also may get T cells, which is the one kind of white blood cells you have in your body that at a certain number, and that also gives you a definition, qualifies you for a definition of AIDS. It's just a matter of definitions, and how you feel and what you do with your body is really what's more important than anything else. Right.
All righty, good. Well, I'm so thankful that you came and talked to us about this so very important topic. And we must, I always say this, but we must have you back, because it's just so many topics in infectious disease that we can go over. I really appreciate you taking the time out of your busy practice and coming to talk with us.
Thank you, Omar. Thank you for making time for HIV. It was very important subject matter for us, and helping us to pass the word to all the patients in the community that's important to be tested and see your doctor about it.
All righty. Thank you very much. All right. So we're moving along, and right now it's our Let's Talk segment. And basically this week what I'd like to talk about is deep venous thrombosis. And basically what that's talking about is clots in the legs. or it can be in the lower pelvic. In the venous system or in the veins, there is a clot that forms. And why this happens? Most of the time, this happens because we're either in a position like I am, sitting with our knees bent for a long time, or laying in the bed for quite some time in one position, and the blood gets a little sluggish and the blood clots and it forms a clot, and that's a bad problem. The reason it's a bad problem because that pieces of that clot can break off and travel up the veins in through the right side of the heart and get wedged into the lung, into the vessels of the lung, and you become very short of breath. That's called a pulmonary embolus. And if that happens, it can be life-threatening. So it's very, very important that you understand that deep venous thrombosis, number one, there are certain signs that you would know that you have it. It would be like pain in your lower extremities or your legs. It'd be swelling in your legs, and you can have redness in areas of your legs and tenderness. And you should go to your doctor and find out what exactly is wrong. They will do something called an ultrasound, or it's like a sonogram to the legs that will determine if the vessel has a clot in it. And if there is a clot, they will give you a blood thinner. For so many months, you will be on this blood thinner so that you will not produce any more clot. And that way you can protect yourself from the pulmonary embolus, or the clot traveling up to your lung that could be life-threatening. You know, it's just so good that we are able to have this show. And in closing, I would just like to say, never institute any change in your medical therapy before you consult your physician. Also, I would like to say that, remember, caring and sharing. www.medmoments.com. Basically, that's a website that you can go to. And then that website, you can email me and let me know exactly what's happening out there. Because I want to know your med moments. I want to know exactly what's happening to you so that we can, talk about that on the show. I trust each and every one of you continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, I would like to say peace to you all. Very good. Thank you, Dr. Wilson.